Good afternoon, everybody. The UK Health Security Agency has recommended that people in the UK go back to wearing masks. These little bits of blue cloth that go over your face. They have lots of big hole in the sides of them. Air can go in the top and out the bottom. And actually, there's quite significant holes in the fabric themselves that are greater, much greater in diameter than any virus particle. But they still say that people should wear masks again. Well, personally, I never wore one over the last 3 years. And no one in the UK wore masks before 2020, apart from tourists from China, because they're kind of used to doing it there, because there is really, really bad air pollution in cities like Beijing and so on. And they just something they do. But no one in Britain ever wore masks until 3 years ago, when that agency, well, it used to be called Public Health England. They've renamed themselves to make themselves sound a little bit more tyrannical, I suppose. We're now a health security agency. So it's sort of like, try to make themselves sound a bit more scary and authoritarian, so you think you have to obey them. But what they've said is actually it's guidance. It's not law. It's not compulsory. It's just guidance. They're suggesting that's what people should do. They're also saying and suggesting that people should delay going back to work and delay going back to school, because you know what? It's winter and there are some bugs going around, because it's January. In January, in the winter time, it's usually every year a peak time for flu to go round, rhinoviruses, coronaviruses, adenoviruses, etc. Some bacteria, people get strep cough. These things go around in winter, and they're going around this winter as well. But because of the last 3 years, some people are more afraid of these things than normal, even though, what's happening is just quite normal. For example, in 1968, 1969, there was a huge flu year. That was a big, big flu season, actually, with 80,000 excess deaths in the UK. But nobody batted an eyelid, really. Nobody, stopped going about their lives as normal. But now here we are, after the situation of the last 3 years, and people are on eggshells and on, really, really nervous about things. What I would say is, this is guidance. You're not required to do this in law. Even if you were required in law, last time there were things called exemptions, but you can stand in your sovereignty if you like and do all of those things. I did, and not do those things. Not cover your face with these things that they insist you did. So that's the situation. But whereas this is just guidance and so on, is sort of indicating a bit of a shift, very, very slow shift that's going on, because also what's happened is that the Prime Minister has announced that there's going to be mandatory testing for people travelling to the UK from China. Now, I'm totally against that, because there's no point. Even the World Health Organization says that PCR tests run on over 35 thermal cycles have no diagnostic benefit whatsoever. They can give false positives. That's the WHO that says that. So, my opinions on this, which would go further than that. And I've said that in other places. So what to do about this? Well, just carry on life as normal. Don't be afraid. This is flu season. Flu goes around. And if you haven't had this thing, then you're probably going to be okay. So chin up, carry on, go about your lives as normal, and enjoy it.